our third paper presenter, we have an expert from the Division of Pharmaceutical Sciences. Her specializations are on drug analysis and quality control and on separation sciences. She is currently a professor and dean of the La Salle Health Sciences Institute, Dasmariñas, Cavite. An NRCP Achievement Awardee in 2015, she has 12 published scientific articles that garnered a total of 120 citations. Today, she will share with us the results of her study on determination of herb-drug interactions in the use of top medicinal plants in the Philippines. We are pleased to have Dr. Alicia P. Catabay. Ma'am.
So our study is in the determination of herb-drug interaction in the use of top medicinal plants in the Philippines. I am Dr. Alice Catabay and I will be discussing this as part of our celebration. So if you will look at the screen, what do you see? Okay, so these are actually the top 10 medicinal plants in the Philippines. And this has been researched quite a lot. No? About 70% of the world population actually use or currently use herbal medicine. And they do so because they think that they are actually safe. But are we sure that it is actually safe? So herbal medicines and botanical products in dietary supplements have been demonstrated to carry same dangers as that of the pharmacologically active compounds found in modern medicines. So these are the countries in Asia that actually use herbal medicine. And if you will look at the percentages, you will see that they use it quite a lot in their medical practices. No? So these herbal drugs are actually used as complementary medicine. Some doctors actually prescribe the use of this herbal drug instead of. And in some cases, these herbal drugs are used as part of integrative medicine. Up to 72.8% of people with diabetes actually use mostly herbal medicines and dietary supplements. So if you will look at the graph, you will see that in addition to other common practices, the use of herbal drug has been entrenched in some of these countries. Nearly 25% of American adults use dietary supplements, and they do so with prescription medication. Like if you have diabetes in the Philippines, you are encouraged to take charancha or sige, mag-ampalaya ka kasi it will help your diabetes. So what will be the danger for this? Now, are we sure that there will be no drug interaction? Are you using any of these drugs? It is estimated that 1 out of 2 patients with a chronic disease will consume an herbal medicine to improve their health, their welfare, even without consulting a physician or a pharmacist. We consult our neighbor, we consult our friends, and we just want to emphasize that natural is not always safe, as we will point out later on as we look at the study that we have done on this. So what is cytochrome P450 and drug metabolism? So they are enzymes that actually facilitate the metabolism of your drug to its constituent metabolic product so that you can eliminate it. Once your drug has given you the expected pharmacologic effect, you expect it to get out of your system, right? So if you will look at all the CYP, so in the slide, you can see that there are various CYP enzymes that are actually utilized for drug metabolism. And we will be looking at 3 of these. So you have CYP1A2, CYP2D6, and CYP3A4. So we chose these 3 enzymes because these are the enzymes responsible for the metabolism of most drugs that we buy for our simple ailments and for our chronic diseases. Okay? So this is our standard metabolic reactions. Okay? So for CYP1A2, the reaction is with 7-MR. O-demethylation will happen to form the resorufin. So what is resorufin? This reaction actually shows you that the CYP enzyme metabolizes 7-MR And the metabolic product is a product that actually fluoresces. So meaning you can measure or you can quantify the amount of fluorescence. The same way for CYP2D6 and CYP3A4, they have specific substrates that actually forms fluorescence samples or fluorescent metabolites. And these are the ones being measured. So what will be the role of herbal drugs in this case? The herbal drug actually will show that they can or cannot interfere with this reaction. So in layman's term, what will happen is like this. So if you have a product added to your reaction, for example, the CYP1A2, you added your herbal product. If this herbal product is an inhibitor, the reaction will not happen. So if the reaction will not happen, you don't have the fluorescence. And the decrease in fluorescence actually shows that your product or your herbal medicine is actually interacting with the reaction. The study involved the preliminary investigation on the inhibition of CYP1A2, CYP2D6, and CYP3A4 enzymes. What we use are human liver microsomes, expressing drug metabolizing enzymes, including cytochrome P450. The enzyme inhibition of the CYP450 isoforms was determined using a spectrophlorometric technique that involved enzyme-specific substrates. Again, to review, you have your 7-MR, we have the BFC, and we have the BQ to study the inhibition of these three chosen cytochrome enzymes. The substrate at half saturating concentration, which we determined previously, were incubated at 37 degrees centigrade with your pooled human liver microsomes. Phosphate reaction buffer was added as well as nicotinamide adenine dinucleotide phosphate so that you have the complete reaction. So the mixture was centrifuged to separate the microsomal protein determined using our fluorostar. So this actually determines the emission and excitation wavelengths. Extracts showing more than 50 inhibition of top saturating substrate concentrations were considered as having an inhibitory effect on the enzyme. Okay, so we did optimization of the procedure, and the optimization include extract concentration, substrate concentration, the order of addition of extract and substrate, the inclusion of pre-incubation, and the duration of incubation. So this is the CYP1A2 inhibition profile of all the 10 medicinal herbal drugs. Okay, so if you will look at this structure, you will see some of the herbal drugs enclosed in those dotted lines. So you have there your Tsaanggubat, Nyugnyugan, Sambong, and Acapulco. These are actually the compounds that exhibited the high percentage inhibition value. If you will look at Nyugnyugan, at half concentration, you already see inhibition. So if you will look at the next slide, okay, that's CYP2D6 inhibition, you will see that the inhibition that are shown by your herbal drugs are not that significant. The inhibition is so minor that it will not affect the production of fluorescence. However, in CYP3A4, if you will look at bawang, it's only bawang that actually exhibited inhibition, high percentage of inhibition. As a conclusion, we have seen that Tsaanggubat, Nyugnyugan, and Sambong may have the ability to inhibit CYP1A2 in a dose-dependent manner. Acapulco only exhibits enzyme inhibitory effect at 10 to 50 micrograms per ml concentration. Lagundi and Ulasimang Bato have moderate CYP1A2 inhibition. Bawang may have an inhibitory effect against CYP3A4. And due to the possibility of CYP inhibitory action of herbal medicines, their concomitant use with certain drugs should be considered with caution. So what do we mean exactly when we say that herbal drugs inhibit these enzymes. When you take your drug and it has exerted its pharmacologic effect, the next thing that will happen is that this will be metabolized so you can actually excrete it. However, if you have enzyme inhibition, the enzyme of metabolism will not work because it will be inhibited. It cannot metabolize your pharmacologically active compound to its metabolite so that you can excrete it. So what will happen therefore is that you will have a prolonged effect of your drug, or you will have toxicity because it might increase the level of the drug in your system. So that's it for today, and I hope you stay tuned for another session like this by NRCP. Thank you again for listening.
Thank you, Dr. Catabay. So, to all our participants today, a little caution when we take this medicine, the supplemental medicine. So, thank you, and we will be back with you during the Q&A. Thank you, ma'am.